These are the first pictures to emerge of the British victim of the highly infectious Ebola virus. The man known as William is wheeled onto a waiting military jet. According to the Department of Health, he's not seriously unwell yet, but his best chance of survival is to be brought back to the UK. When he arrives, William, who's in his late 20s or early 30s, will be treated in this isolation unit at the Royal Free Hospital in North London, the only one of its kind in the country. The bed is sealed off from the outside world to protect medical staff and stop the disease from spreading to the general population.
What I would like to emphasise is that the risk of Ebola virus infection to the population of this country remains very low and is not changed by this decision. The precautions are what I describe as belt and braces. We want to be absolutely certain that there is no risk of infection by this patient of others.
It's understood he became infected whilst working as a nurse in eastern Sierra Leone in the Kenema area. He wasn't working for any official charity but had made the journey himself. It is just one of the countries in West Africa in the grip of an Ebola epidemic. Since the outbreak began, the UN says more than 1,400 people have died. Initial symptoms are a sore throat and fever, which turn into severe internal bleeding as the virus attacks organs and tissues. But it isn't an airborne virus, so can only be transmitted through bodily fluids such as blood, vomit and sweat. That's why health workers are at risk. It can take up to 3 weeks for symptoms to appear after a person is infected.
There is no cure for Ebola virus despite the various experimental drugs that we've heard about recently. So the doctors that are looking after this patient will be focusing on maintaining the patient as clinically stable as they possibly can. And if there are any secondary infections like pneumonia or a fungal infection, they'll be treating those. But that isn't a treatment for Ebola virus itself. Whether the patient survives Ebola virus or not depends largely on how good their own immune system is.
Today is a miraculous day. I'm thrilled to be
Doctors
alive.
will be encouraged by the recovery of American aid worker Dr. Kent Brantley. He was flown back to the US and given a revolutionary experimental medicine. It isn't known whether William will be given access to the same treatment. The Department of Health says the risk to people in the UK is minimal, but that's not the case in West Africa. Their medical facilities are overwhelmed as the disease continues to spread and claim lives.